Hi there, and welcome to this video learning series. My name is Lara Okoloko, and I'm a provider educator with the University of Washington's Addictions, Drug, and Alcohol Institute, where I support professionals like you working in behavioral health and substance use treatment. I'm also a clinical social worker with experience in both direct practice and teaching, and I've worked with interdisciplinary teams helping people and their families navigate substance use and mental health challenges. In this video, we're going to be talking about psychosis. Let's get started. Psychosis is an experience of loss of reality and can happen for many different reasons. During an episode of psychosis, a person's thoughts and perceptions are disrupted. They may have difficulty recognizing what is real and what is not. If you've watched some of the other videos in this series, you'll know that we took a look at how commonplace different mental health conditions are. Substance use disorders, for example, are experienced by about 1 or 2 out of every 10 people. Compared with substance use disorders or other common conditions like anxiety or depression, psychosis is much less common. Over the course of someone's lifetime, about 3% of people will experience psychosis. They may experience psychosis because they have another condition like schizophrenia or schizoaffective disorder, as about 1% of the world population does. But people can experience a psychotic episode in their lifetime and not meet criteria for one of those other disorders, for example, because of drug use or a period of extreme stress. The chance that someone does experience psychosis increases in the teen and early adult years. In this video, we'll learn about different reasons why someone might experience psychosis. One risk factor for experiencing psychosis is drug use. People who use methamphetamines and people who use high-potency cannabis products are at increased risk of psychosis. Symptoms of psychosis can include delusions. These are false beliefs. For example, someone may come to believe that their caretaker is poisoning their food, or that the newscaster on the 5 p.m. news is sending special messages through the weather report. Another symptom are hallucinations. These can be things that people are seeing or hearing that other people do not see and hear. For example, hearing voices telling them to act in certain ways or criticizing them. And disorganized speech or behavior. This might include speaking in sentences that sound like a jumble of words, or speaking in sentences that make sense but don't convey meaning that is understandable. The first episode of psychosis typically develops during teenage or young adult years, and early intervention is important. Medication is a frontline treatment, and supportive therapy can be helpful. People can develop psychosis for many different reasons. We already discussed the risk factor of methamphetamine use and high-potency cannabis use, but cocaine or severe alcohol use disorder can also cause psychosis. Some people develop psychosis related to a medical condition, such as delirium, dementia, withdrawal from alcohol, medication side effects, extreme periods of not being able to sleep, or hormonal changes related to postpartum or menopause. Psychosis can also be related to certain mental health conditions, delusional disorder, depression with psychotic features, bipolar disorder, schizophrenia, severe PTSD, or extreme stress. Next in this video, we'll hear from Dr. Mark Duncan on drug use and psychosis.
Hello everyone, this is Mark Duncan and I'm an addiction psychiatrist at the University of Washington. As Laura was mentioning, there are certain types of drugs that can cause psychotic symptoms. These include alcohol, cannabis, cocaine, methamphetamine, hallucinogens, and drugs like PCP or ketamine. Drug-induced psychosis usually goes away in less than a month. Most of the time, it gets better in a few days or weeks after the person stops using the drug. Sometimes, especially with drugs like amphetamines, PCP, and cocaine, the symptoms can last longer, sometimes for weeks, even after starting medicine to help. Most people feel better within 30 days of not using the drug. If someone still has psychotic symptoms after a month, it could mean they have a psychotic disorder like schizophrenia, not just one caused by drugs. A small group of people, especially those who used cannabis, stimulants, or hallucinogens, can have problems that last a long time or develop illnesses like schizophrenia or bipolar disorder. Studies show that just over 1 out of 4 people with drug-induced psychosis will later get a long-term mental disorder like schizophrenia, most often within 2 to 3 years. What are the differences between drug-induced psychosis and a primary thought disorder, or psychosis caused by other mental health or medical conditions? Well, drug-induced psychosis involves delusions or hallucinations directly caused by substances, medications, or toxin exposures. Diagnosis requires evidence of recent or ongoing use with symptoms starting during or soon after the exposure. Symptoms often resolve after stopping the substance but may last for weeks, as stated previously. Other indicators for a drug-induced psychosis are the development of psychotic symptoms at an unusual age, such as onset in a male over 35 years old, or symptoms that come and go. For primary thought disorders like schizophrenia, they're diagnosed when psychotic symptoms are not linked to a substance or medical condition. These disorders tend to be chronic, often begin in the late teens or early 20s, and usually persist for at least a month after stopping a substance. In addition, a history of psychotic disorders in the patient or the family supports a primary thought disorder diagnosis. For psychosis due to other medical conditions, this is diagnosed when delusions or hallucinations are judged to be a direct result of a specific medical illness that could be neurological or endocrine or metabolic or an autoimmune disorder. This can include certain types of tumors, certain types of dementias, or severe infections causing delirium. Treatment of these symptoms includes both the treatment of their underlying medical condition and sometimes the use of antipsychotics. What are some reasons people with a primary psychotic disorder use drugs? Well, people with primary psychotic disorders often use drugs or alcohol to feel better when they are sad, bored, or feeling left out. They may also use these substances to try to feel pleasure or be more social, especially if they have trouble enjoying things or being around others. While some people think that these individuals use drugs to treat their psychotic symptoms directly, often called the self-medicating hypothesis, there isn't much proof for this idea. Genetics and changes in how the brain works can make someone more likely to have both psychosis and problems with substance use. In schizophrenia, there is some evidence that even suggests that both cannabis and nicotine can reduce some of the positive and negative symptoms. However, the overall outcomes in people with schizophrenia are often worse when they use cannabis and tobacco. In summary, the main reasons people with psychotic disorders use substances are to feel less unhappy. But social and environmental factors and brain and genetic vulnerabilities also play a role.
Thank you, Dr. Duncan. Now let's learn about schizophrenia. This is a mental health condition that includes the symptom of psychosis. Schizophrenia also includes negative symptoms and cognitive symptoms. Negative symptoms are called negative because they are the loss of something, the loss of motivation, loss of interest or enjoyment in activities, withdrawal from social life, or difficulty showing emotions. Cognitive symptoms include problems with attention, concentration, and memory. This can make it hard to follow a conversation or learn new things or remember appointments. Now let's talk about safety for people with schizophrenia. Most people with schizophrenia are not violent. However, having schizophrenia may increase the chance of violent behavior. Overall, people with schizophrenia are more likely than those without the illness to be harmed by others. For people with schizophrenia, the risk of self-harm and violence to others is most significant when the illness is untreated or when it co-occurs with alcohol or substance misuse. The frontline treatment for people with schizophrenia are medications to help manage or eliminate their symptoms. For many reasons, including side effects or lack of awareness about one's own symptoms, some people will stop taking their medications. We should always encourage people to talk to their prescriber about their concerns rather than stopping medication on their own. However, not everyone chooses to use medication, and we can still respect these difficult decisions and help by expressing understanding, validating emotional experiences, assisting with maintaining stable housing and supportive relationships, and meaningful activities, including supported employment, while still encouraging people to work with their prescriber to find the right medication that can both manage symptoms adequately while minimizing side effects. You may also have heard of another related condition called schizoaffective disorder. This is best understood as schizophrenia plus a mood disorder. Now I want to tell you about an important symptom to understand, anosognosia. This means being unaware of your own illness. Remember, psychosis is a break with reality, and that often does not come with awareness that you're experiencing a break from reality. This is completely different from being defensive or stubborn or in denial. Now let's turn our attention to how to speak with someone who's experiencing psychosis. The information on the following slides comes from a few sources, and you can read more about them. One of them is the American Association of Emergency Psychiatry and their project on de-escalation. Also, the National Alliance on Mental Illness and their publication on how to help someone experiencing psychosis. And the book by Dr. Xavier Amador, I'm Not Sick, I Don't Need Help. We're going to discuss 5 areas that can help us in our communication with someone with psychosis. We're going to discuss managing our own reactions, wise use of body language, voice, and space, listening actively, finding agreement where we can, and focusing on the person, not the delusion. Let's start in the most important place, managing ourselves. If someone's agitated, or even if just their problems feel so big, it's easy to get defensive or frustrated or scared, especially if they're blaming you. But the truth is, if you lose your cool, things will only escalate. Your main job is to stay calm and self-aware. Take a breath, keep your voice steady, don't get caught up in arguing or retaliating against accusations or insults, and remember, your safety comes first. If you're too frightened or overwhelmed, you won't be able to help de-escalate. In those moments, it is not a failure to step back and get help. It is the smartest move. Now let's talk about how to use body language, voice, and space wisely. Communication experts say that most of our communication doesn't come from our words. It comes from our tone of voice, our body posture, and our facial expression. So if you say, "I'm here to help you," but your arms are crossed and your face looks tense, the message isn't going to land as trustworthy or helpful. Let's try this right now. Drop your shoulders, relax the muscles of your face, loosely open your palms. Can you feel the difference that makes? It can make a big difference to keep your posture open, your voice calm. Avoid staring the person down. And if someone's agitated, give them space, at least 2 arms lengths. Don't block an exit. Small choices in your body language and positioning can send a huge message of safety and respect. Let's talk about active listening. This is a skill you probably already have. People want to know they're being heard. That doesn't necessarily mean you have to agree with everything they say, but you do need to listen closely and reflect back what you hear, focusing on what the person's feeling. So something like, "This situation with your records has been really frustrating for you." Focus on empathy, not debate about the facts. Even if what they're seeing, hearing, or believing isn't real, their emotional reaction to it is real. This isn't about winning an argument. You're not going to convince your client that their perception is wrong. It's about showing the other person that you genuinely care about their experience. Arguing or convincing is not going to get you anywhere. On the other hand, agreeing or endorsing a delusion is not helpful either. So what path does that leave you? Instead, look for truth that you can agree with. Maybe it's a fact, like, yes, you've had 3 case managers in the past year. Maybe it's a principle, like, I agree, everyone deserves respect. Or maybe it's normalizing. Most people would be upset if they had to wait this long. When it comes to delusions, don't argue and don't endorse. You can validate the feelings, "Oh, that sounds scary," and then shift to shared goals. "Hey, we may see the cause differently, but I think we can work together on helping you feel calmer and getting some rest tonight." That way, you're connecting and helping without joining with the delusion. At the end of the day, the delusion isn't the main thing. The person in front of you is. If someone's distressed, acknowledge that distress. Show empathy. practical help when you can, even small things like a ride or a bus pass, food, or support to make a phone call. These concrete actions can build trust and lower agitation. And as that trust grows, your ability to support them in bigger ways grows too. Always remember, your relationship with the person matters more than debating what's real or not real. I hope that at least one thing we covered in this video is helpful to you. Thank you for the work that you do in your community, and thank you for watching.